Good day, everyone. It is Test Tip Tuesday, and we are currently on our last week of Pharm Review. But we will continue to see pharmacology because it will show up in other categories. So, just because we're doing Pharm Review doesn't mean we're done with Pharm. So, we're in the NCLEX Review Masterclass, and if you would like to join the next NCLEX Review Masterclass, just reach out to me and I can tell you how to be a part of the next group. We are 4 weeks in right now. Some people are getting in kind of in the middle. This might be an okay time to start. Just start at the beginning of the week. That's fine. But if you would want to prepare a little later and start from the very beginning, that is fine as well. And I can let you know when the next NCLEX Review Masterclass will be. So let's get right into this question. First, for some introduction for today. This is Test Tip Tuesday, where I come to you with a NCLEX question of the day and an NCLEX test tip. And so today we're talking about strategies, testing strategies to master those pharmacology questions. All right, especially teaching questions or reinforcement questions. This is an LPN LVN question. And the first thing you want to do, your first step, is break down the case event. Who is the patient in this question and what's wrong with them, or what do they have going on? All right, let's read our case event. The nurse is reinforcing teaching. So that's really what's going on, teaching. Who is the nurse teaching? A client who had a renal transplant 3 days ago and is receiving cyclosporine. All right. So immediately you want to think about, this is a newly kidney transplanted patient, only has been about 3 days ago. Why would they be getting cyclosporine? So you want to connect the two. The main issue or problem, safety thing that we're assessing and trying to protect this patient from is rejecting their transplant. They're in that early stage where we want to make sure they don't reject their new kidney. So more than likely they're going to be placed on a medication that prevents rejection. So you want to connect the two. That is a testing strategy. Now we're going to break down the question. Next step, the query. The query says, which of the following information should the nurse reinforce? That reinforcement tells me it is something that you would, as a nurse, tell your patient. It is going to be a positive answer. Therefore, we are going to eliminate. You want to eliminate negative choices, eliminate things that may not apply to this medication, things that we would not tell the patient or teach them. And some of that content or information, in the way it's worded, might come across incorrect, or the patient may misunderstand. All right, so I just want to look at your testing strategies first of all for subject. So our subject here is Pharm. They're not asking us about intended effect, side effect, adverse effect, or toxic effect per se, but that may play a part in how we answer if they give us correct information that I would teach the patient about the effects of the med. So anytime I'm teaching somebody, I'm always thinking, number one, what will I teach them? What the med is. Here's your med. This is a new medication. This is a patient who's has this new renal transplant, and I do want to inform them what the med is for. But we'll have to let our options kind of guide us in that direction if they're giving us correct information according to the effect of the med. Focus on the diagnosis. They do give us a diagnosis, so we are going to focus on that diagnosis. Renal transplant. What meds do they get during a renal transplant, or to help them recover and have a positive response from that kidney transplant? They're going to need an immunosuppressant. So even if I don't exactly know the med, that may be a clue. 3 days out from a renal transplant, what are patients likely to receive? Use general guidelines and assessment data collection guidelines. We're going to use those guidelines as we read through the options to help us use our process of elimination, your clinical reasoning. If there's any terms or anything that we're not familiar with, sometimes that medical terminology definitely comes in handy to determine the medication classification or the definition and meaning of certain terms and words. Let's go through our options next. So once you go through your case event, you've gone through your query. Next is to go through each option, reason it in or out, and know why. If you're practicing questions, you want to be able to say to yourself or to say to somebody or to your tutor, why is that answer correct or incorrect? Why do you think we need to eliminate it? Why is it a positive or a negative? So keep in mind here, we are looking for a positive answer. So we're going to say look for, but I am going to eliminate negatives. Use that process of elimination. Use common general knowledge. Option 1, you should increase your intake of grapefruit juice while you're taking cyclosporine. This is a general medication guideline. There are a few medications where grapefruit juice is okay. I still wouldn't say increase it. I don't think grapefruit juice is going to help, but there are two meds. One particularly is phenytoin that I can remember right offhand, but there's very few. That one is the one I can think of that I see a lot of questions on, is not affected with grapefruit juice. But most other meds, no, grapefruit juice is out. So we're going to get rid of this one. And this is more likely a negative. Option 2, notify the healthcare provider. You should notify them if you experience a sore throat. A sore throat here is usually related to signs and symptoms of an early infection or disease process happening. You're getting sick. Remember, what happens when you wake up with a sore throat? If you didn't go to bed with that sore throat and you wake up with it, you're going to wonder, am I getting sick? Am I getting ill? Is this my immune system responding to an illness? Is this allergies? Either way, there's something happening. Could this patient be at a risk for infection? Yes. If they're on an immunosuppressant medication that suppresses their immune system from rejecting that kidney, they are going to be at a high risk for infection. We're going to put a plus sign here to signify that that is positive. We're going to keep that one. Option 3, you may experience decreased urine output while taking cyclosporine. This is an answer that is true. It's a true statement that you can. A lot of medications are going to affect the kidneys, and that's something that is a negative response to the medication, but you want to read that carefully. Should you reinforce that? If I tell a patient you may experience a low urine output, does that sound like this is something that they're going to expect to happen? Or is that something that they need to report to a healthcare provider? Tell the nurse, tell the doctor, my urine output is decreasing. All right. So that could be really a negative response. And we do want this renal transplant to take, and we want this patient to not reject the kidney transplant, and we want to make sure it starts functioning appropriately. So if we leave him with that bit of information, they may think it's okay if his urine output is decreasing or is less than what it used to be, or is it supposed to work? Is his kidney supposed to start kicking in and functioning like a normal regular kidney? Yeah, it should. It's a renal transplant. So let's get rid of this one. It sounded like something that was positive to tell the patient. It sounds like a true statement. It is true. This medication can cause an effect on the kidney, but if it's doing so, he doesn't need to just think that it's expected. We need to be saying you should notify your healthcare provider. So that can be misinterpreted. You will need to take this medication until your new kidney is functioning. Here again, this sounds like once their kidney is functioning, I'm going to come off of this medicine, or I'm going to stop taking it. It is truly the healthcare provider who should inform this patient case by case depending on the individual, whether or not they can stop taking the medication. We're hoping the kidney function will resume within the reasonable amount of time described by the healthcare provider. Just because it starts to function early on when it should does not mean that they're going to stop taking the medicine. This again can imply that, oh, my kidneys are working and I'm going to stop. You will need to take this med until it's functioning. No, you may still need to take this medication to prevent your body from rejecting the kidney. So this again is a negative. 3 and 4 sounds okay, but it's a surface type of response. And remember, is that something you want to say to a patient? You want to put this in a context of, is this just a statement, or am I teaching the patient what they should do? 3 and 4 really doesn't teach them. It sounds like it's expected that they're going to come off the med when the kidney stops or starts to work. And it sounds like, yeah, when your urine output is decreasing, you may experience that. It's not really expected, and we really can't say when you're going to stop taking this med. So we reason those out, and that gives you option 2. Option 2 is the most positive. It's the most definite thing that you are going to inform your patient that they are going to be at a higher risk of infection, and you want them to monitor for signs and symptoms of infection. Our medication here was cyclosporine. We are going to look at a drug card. This is azathioprine Imuron, which is, it's cut off here, but it says immunosuppressant agent. Here are the multiple meds here up under this classification. Azathioprine. I remember having patients on Neorel, which is cyclosporine, mycophenolate, and there's methotrexate. Now, these meds do have multiple indications. Not all of them are used for renal transplant to prevent a graft rejection, but here is an indication. It could also be used for autoimmune disorders like rheumatoid arthritis, suppression of cell-mediated immunity, and altered antibody formation. Undesirable effects are listed here. Other specific information. Some interventions assess for infection. We're also going to monitor their liver function. There's our dark urine. Dark urine can mean there is an issue with the liver. It does not always mean there's an issue with the kidneys. Jaundice, itching, all that's liver related. LFTs, liver related. So we will be doing labs, blood studies, monitoring for hepatotoxicity, and assessing for arthritis pain for patients who may be taking it for something like rheumatoid arthritis. Education, we tell this patient don't miss or skip any doses. Therapeutic response may take place in 3 to 4 months. This depends on what they're taking it for. Instruct the patient to use contraceptive measures during treatment for 12 weeks after finishing the treatment. Avoid vaccines. Why? Because they are going to be immunosuppressed, and a vaccine could actually cause an infection, and it may even they may not even be able to produce the antibodies when they get the vaccine. All right. No live vaccines for this patient. Oral forms, give it with a meal. Monitor for fever, rash, lymph nodes, swelling, signs of infection. It's used for organ transplantation and autoimmune diseases. We're going to monitor their CBC liver enzymes. And Imuron, in addition to other drugs, lessen or prevent immune response. All right. We got through that. Next, we're going to take a look at some things that Saunders review says about this medication. All right, really quick, this is in Saunders review, Page 814, renal and urinary problems of the adult client. Medications for preventing organ rejection. We have meds that are going to include immunosuppressants, corticosteroids, cytotoxic meds, and antibodies. Here is our cyclosporine. It is going to inhibit calcineurin and acts on T lymphocytes. Basically, it's suppressing the immune system. It is going to prevent rejection of kidney, liver, heart transplant. It may be given with a steroid such as prednisone. Blood levels need to be measured. The most common adverse effect is nephrotoxicity. So we would want to teach the patient that if their kidney function is declining, that needs to be reported. We don't want them to think that's expected by saying you may have this. Adverse effects, neurotoxicity, GI effects, hyperkalemia, hyperglycemia. Down here they talk about also infection, hypertension, tremors. Risk of infection. Contraindicated in the presence of a hypersensitivity, pregnancy, or breastfeeding. Embryotoxic. So persons of childbearing age should use a mechanical form of contraception. Avoid oral contraceptives. They're not going to be as effective. Inform the patient about the possibility of renal damage and liver damage. Therefore, we need to be reporting that if they're having symptoms of decreased urine output. Here's our information on grapefruit juice. It is prohibited because it raises cyclosporine levels and increases toxicity. All right, we'll look at a few things about renal transplant. All right, last but not least, as you're studying a question, as you're allowing a question to guide your study, you want to dip more into not only the medication, but let's look at the diagnosis of the patient. What should we know about a kidney transplant? All right, they tell us here, this is page 797, transplanted kidney is placed in the anterior iliac fossa. Except for those with polycystic disease, usually they leave the diseased kidneys in place unless they are very enlarged and painful. Urine output usually begins immediately if the donor was a living donor. So it depends on the type of donor that they get, whether or not their kidney is going to function right away, but it may be delayed for a few days or more with other donor types. So we should expect either immediate to a few days response of this kidney. And so no, they probably won't just stop taking it once the kidney is functioning. They may need hemodialysis until there's adequate kidney function. We're monitoring again for signs of rejection. Urine output, immediately report abrupt decrease in output. So they could be taking the cyclosporine, but we want to report decrease in urine output. We're monitoring weights, vital signs, the typical post-op things we would do for a patient. Note that urine may be pink in the beginning and bloody initially, but gradually it's going to return to normal within several days to weeks. If there is gross, obvious hematuria and clots, then we want to let the surgeon know. They may even have a bladder irrigation prescribed. All right, here are some clinical signs of renal transplant. Anything in these boxes are important. Fever, pain, tenderness, edema, hypertension, malaise, BUN, creatinine levels are going up. Decreased creatinine clearance, white blood cells going up. Rejection indicated by an ultrasound or a biopsy. Here are some other instructions for a patient with the kidney transplant. They're going to monitor their eyes and nose, avoid prolonged periods of sitting, monitor for those signs of infection like that sore throat, use the med as prescribed, and maintain, and this does tell us that they don't skip any doses and they're going to maintain immunosuppressive therapy for life. So that tells us that more than likely they're not going to stop the medication when the kidneys are functioning.